Just let me know if there's a lag. My internet is acting up. Hi everyone. My name is Sakeen Mihar, and I'm the CEO and co-founder of Savyn. We are a digital trauma therapy platform using neuroscience. And I wanted to tell you a little bit about my story. I'm a survivor of war. I've experienced war firsthand, and I've lived experience with PTSD. And I used to regularly get panic attacks and did not know that I was experiencing that. And I wasn't able to access care until about 8 years later when I was working at the university and had access to employment benefits. I was then diagnosed with PTSD and got access to care. So I'm not the only one with this problem. 70% of adults will experience a traumatic event in their life, with 35% of those affected not getting access to care due to financial, cultural, language, and other burdens, other barriers, which is currently costing the Canadian government up to $56 billion. So the current treatments that treat PTSD are quite labor intensive and expensive, costing about $180 for a 45-minute session. The most common or most well-known one is CBT, or cognitive behavioral therapy, which everyone knows as talk therapy. This has one of the highest dropout rates for treating trauma. It takes about 18 weeks to see symptom reduction for trauma and PTSD. And exposure therapy is another treatment protocol that's often used with a less dropout rate. But EMDR is what stands out, eye movement desensitization and reprocessing. It's a therapy protocol that's based on neuroscience. It uses both the left and right side of the brain through some sort of bilateral stimulation, either like an eye movement or sounds, to activate these parts of the brain. And over time, the scene that's associated with the trauma reduces and the fear responses reduces. And you see results in short 8 weeks. It's been around for 20 years. It's recommended by the World Health Organization. However, EMDR is not readily accessible because there isn't enough therapists that offer this service. So to solve this problem, and with my lived experience, we spoke to many EMDR therapists. This was during COVID. When we were talking about how can we digitize this really great therapy protocol onto a digital platform. Initially, we got a no, but we worked through funding from the government to build this platform. We went back and forth. We have actually pivoted some of how we provide this offering and came up with a protocol that is able to mimic EMDR on a digital format and reduce the symptoms. So I do have a quick demo to play that shows how this works. So here you will notice that on the left side, oh, it's slow. On the left side is the person who's doing the protocol, and on the right side is our actual platform. So our platform is a web application. They're following instructions. They're doing some breathing. And here, like, I'm going to skip just because of time. There's a lot of instructions on how to follow the steps that's needed. And then most of it is in audio format. And this is where the eye movement is happening. So we do 3 sets of this eye movement, which is the lateral movement. This is also sped up very fast. Usually this is a 45-minute session. And they follow these instructions. They do 3 sets. It's an interactive application where they're reporting on their symptoms, where they're feeling it. They also record what's coming up for them. And they end with a grounding tools. So because this was the first time we had digitized EMDR, there wasn't enough evidences to show how a digital EMDR application from end to end affects patients. So we went into a study that was sponsored by MyTax, along with Sick Kids Research Institute, for adults that were diagnosed with PTSD and who were in a severe motor vehicle accident. And one of our favorite stories from this research study was, there was a person who was the partner of a NASCAR driver they were from the US, had severe accident, like they had 3 surgeries. They were really scared to go back into the car, but they came onto our platform and they did this EMDR protocol with us online. And by the 6th, 7th week, she was feeling so much better. There was another car that the partner was, a race that another race the partner was invited to, and she wouldn't even go to the race, or she wouldn't even go into the car, but she was able to do that through our intervention. So this is just one great story that I like to share. But overall, our study showed that we had really great patient efficacy. We had a 92% adhere rates on our platform. We reduced PTSD symptoms by 59%, 64% in symptom reduction, and over 40% in anxiety and depression symptoms. And the clinical outcomes stay at 10%. So if there is a 10% decrease, it's considered that successful, but we far outperform that as well. So we, from our platform, we reimagine how trauma is readily accessible to improve healthcare productivity with faster patient results at lower costs. And when through word of mouth and through networking, we were talking about our pilot study results, which led us to getting a contract with a service contract with one of the family foundations to treat refugees across Canada. So we have onboarded 11 refugee agencies, spoken with 11, but onboarded 6, and we are on track to onboard 100 users by end of this year, 2,000 patients by next year, and 10,000 by 2026. Additionally, we also have a first responder RCMP pilot at St. Joseph's Hospital. We have a private clinic pilot based out of Alberta with who sees 7,000 patients a year. And we just got a contract with USAID to use our platform in international areas, in conflict areas. And we have also filed a patent for North America. And we are in market generating revenue. Our first contract is with North Pine. 6 refugee agencies are currently using our platform with the end goal of having on board 1,000 refugees. It's available in Arabic, French, Spanish, and Farsi. We are rolling this out in these languages. The second contract is with USAID, that is to serve 2,000 refugees in Syria. It's a partnership with the federal funding from Canada, Humanitarian Grant Challenges, and this is to serve refugees in Arabic. So this is our total revenue. And our financial traction, I'm sorry, I'm just in the middle of updating our pitch, so it looks a little funny, but we've raised about 1.2 million, 1 million in non-dilutive and 130 in a pre-seed safe agreement. So this traction led us, and just looking at the competitive landscape, we are uniquely positioned to provide a very high effective PTSD treatment with high access to treatment. And what also sets us apart is that we are also offering a platform in different languages, which makes us go to market internationally quite easily. Our impact and our value is that we are providing care at a very much lower cost with about $108,800 in patient savings, faster patient results with better patient outcomes, and we are scaling services to meet demands and reach 10 times more patients. So our revenue models, we are priced at $250 for a user as a SaaS platform, and our customers are B2B. We are predicting revenue of $3 million by the 3rd year. Our strategy to go to market, we are already in market with refugees. We have our pipeline with clinics and first responders, and then move on to insurance later down the road. These are some of the partners. We have worked with MIT, SickKids, and we've also won the Ontario Brain Institute fellowships, and we've got some social impact recognition throughout as well. Our team is cross-functional, have got unique skills. My background is in product and UX. I've built humanitarian aid products previously as well. Chris is our CTO, brings a lot of technology experience, and Jonah is our investor and fractional co-founder. And then on our board of advisors, we have our PI, who's really very reputed neuroscientist in Toronto and in GTA. And we have EMDR consultants who serve us. And we are seeking to raise 1 million to reach a revenue of 3 million in new markets by 3 years. And most of it would go to scale our technology, some of it to our sales and growth, and some of it to our IP as well. So yeah, let's work together to heal people with trauma. Thank you.
Great job, Sakina. The slides ran smoothly and the video worked as well. So great job. I think we'll dive into feedback, and let's start. I'll invite Maureen. You're unmuted, so I know you're joining us as a coach, but I'd love for you to provide feedback as well as an investor.
Hi, Sakina. Nice pitch. I have some questions around revenue. So you said you had 100 users in 2024, and then you have contracts with North Pine and a US agency. Have those contracts been paid for? Are they paid in advance? Are they 2024 revenue or 2025? How's that working?
So it's USAID or USAID, I guess.
Okay.
2 different ways of calling that organization. So the North Pine is already paid for. That's the service contract we're working to serve the refugees across Canada.
Yeah.
So for this, and 250 is the USAID contract that's to go to Syria. We just received that contract. So it's coming in tranches. So if I was to break it down into ARR, I think for 2024, our ARR would be 250.
250K, okay. But you've only processed or worked with 100 clients so far, is that correct?
Correct.
So, okay, so these guys are prepaying for work to be done in the future.
Yes.
Okay, and your performance data, the 92% adherence and so on, is that based on the full sample of 100 users, or is there a different sample size for that?
Yeah, that's a different sample size. This is a SICKITS study. That was 22 people.
22, okay.
Yeah.
I think it would be appropriate to say the size of sample that data is based on.
Okay.
Good.
Yeah. I can jump in next if that's okay. First off, thank you so much for sharing your story. That's a very personal story to share, and I thought it really added to the pitch and kind of the reason behind it. So thanks for doing that. I loved how there was a demo. I think that immediately just shows oh, okay, what's being used and how that goes. In terms of your traction slide, I would maybe spend a bit of time on that, because those numbers are fantastic. 100 user, you're talking about the partnerships, really try to highlight those numbers more in that slide, make them pop. Those are things that take a long time to get to and you should be really proud of. So I would, maybe rework that slide and maybe move it up higher in the deck, because I think that says a lot about where the company's at. And same with the contracts you have, North Pine, put that logo up there. That the first one's always the hardest, and you have that. So highlight that. And logos they're visually appealing for when people are watching pitches. So I think that always helps. In terms of who pays, is it, you were talking about the B2B model, but I was kind of confused on who's paying for it.
So it depends on who our customer is. So for the refugee agencies, it's usually a granting agency like USAID or the Family Foundation. They pay for it. And then they give us access to the refugees to get those services. But if it was the private clinic, then they pay for the licenses themselves to be used with their clients.
Okay. Is there also an option for people to just find it online and pay personally for the product?
No, we are strictly B2B. That's because of the risk management of the patient. We need, for now, there to a care provider that's supervising and seeing that they are not getting triggered, because this is trauma, and the way they respond to certain questions can be triggering. So there is, because of the risk that's associated with the patients, and because this is kind of like the first product that's doing that, it's not available to the public. It's only through some sort of care provider.
So someone would then review kind of the assessment can be done online, but then a professional reviews kind of like the results and like face with the client. Okay. Or the patient. Okay, that answers my question of like how are people finding this, or how are you reaching your market? So overall, great job.
Yeah, thank you.
Wonderful. Linda.
Yeah, thanks again. That was a great pitch. Like Michelle was saying, really nice to have your personal story added to it to give us some background and context. And I had some similar questions about how it was sold and who who was actually paying for it. But yeah, my other question, I guess, is it an 8-week standard protocol for everyone, or will that depend on how on the patient and the practitioner, I guess?
It's the recommended is 8 weeks minimum. I think we've seen results by the 5th session as well. And as we explore with the pilot at the clinic as well, I think we might come into other models. One of the things we are thinking about is pricing it per seat instead of like just 250 per patient, because also when somebody is treating one specific trauma, other traumas can come up and they can add another 8 sessions, or that they feel better by the 5th session and then they can stop. So we're still kind of getting to that number.
Okay, and is it once a week or daily, or how? Once a week, okay. Yeah, I guess that's all I had. Good job. Thank you.
Mauricia, would you like to go next?
Sure. I had similar questions to what people were asking here, so I've just been checking them off. Pardon my ignorance in this, and great pitch and a really touching story. So I think that goes a long way to starting that off the pitch the way that you did. Pardon my ignorance on this. Are there regulatory approvals for something like this, or no? You don't need to have. There's no clinical trials that you have to submit to any government or anything like that for this. This is, you can, you don't need.
Yeah, so we don't need it because we are positioning us as a B2B SaaS, and we are providing the technology to people who have the authority to provide these services. So the therapists, clinics, agencies, social workers, things like that. But part of our raise is to get that regulatory, because we can go as software as a medical device class 2. Like our end goal is to, is to get bought out by a therapeutics company. Like we are digital therapeutics. So like maybe 2 years down the road, when we have sufficient traction and money, like we do want to get that regulatory approval, then selling to insurance and hospitals and things like that just get really easy.
Okay. So in expanding your market.
Yeah.
Okay. And then on that traction slide, I did like it, but I found that was quite busy. There was a lot of super information in there, but it was, there was a lot in there. So I might break out some of the, categorize them and break them out a little bit, since you've got a lot of different themes, but very well done.
Sakina, there was on one of the slides with the children's sick kids, it said like see appendix for full study. Can we see that slide to see if there's anything we'd recommend like pulling out and like putting on the slide?
Okay, so we measured, so for example, the PTSD symptoms was measured on an assessment called the PTSD checklist. And we did a control and an intervention group. We did a sample independent t-test to see if there was any statistical significance, which implies that like the results are true if there's significance. So this is the control group, and this is the intervention group. So you can see that the PCL for the control group. So the control group did not receive our platform to get treatment, and the intervention group got access to our platform for 8 weeks. And you can see that the folks who got the intervention, their symptoms reduced this much significantly. And the people who did not get intervention, the reduction in symptoms was very small. And this is to remove any sort of like, oh, over time, people's symptoms reduce. So this is why we did the control and intervention. So this is for the PTSD symptoms. Then we measured the distress through something called the significant units of distress scale. That's a scale from 0 to 10, 0 being where they say they felt no distress at all about the traumatic event, 10 being the highest. So usually when people came into our study, their distress was at a 10 or a 9. And by the 5th week, even the 3rd week, it had gone down to 5. And then by the 8th week, it had gone significantly down to a 2 or a 0. So again, you can see the reduction in symptoms between the two groups. And the depression symptoms were measured through something called the patient health questionnaire that was trending towards significance. And we saw that the control group versus the intervention, there was again a significant reduction in symptoms. And then for anxiety, we measured it through something called the generalized anxiety disorder. That's another assessment. And again, the control versus the intervention, we saw a difference. So these were the measurements from the study. We also have another nice one, which is comparing our adherence rate, where we had like really good adherence. But if you were to look at CBT at 8 weeks, they had like a 75% adherence, but to see results, it would be by the 11th week. There was a significant dropout in CBT as well. And this is the actual data from each session for each patient. Like their session 8, their SUDS are going down to a 2. Their intervention, by week 8, their symptoms are reducing as well. And then we also measured their mood, where 0 being like they felt really bad to 5 being pretty good. And like this was somebody who was going up and down, but generally everyone felt better by the end of the 8th week. I think this is just, and there is, I haven't included it, but we also did a 6-month post study follow-up, and their symptoms were still down. We had it in the appendix of another presentation, but I don't have it here. So do you think I should bring any of these numbers up?
I personally always love seeing a graph. Like I find you can I'm a visual learner, so like for me absorbing it's easier. But I'd love to hear what the rest of the group.
I like these slides, this presentation of these slides that you just showed here quite a bit. I found that especially the one that you just showed one back. I think it was just one, that one. Oh yeah, that one was good. The one you were just on, yeah, with the 3 that compare with the 3 different bar graphs. Yeah, that one. I thought that did it, at least maybe it's just me, but I thought that was a very effective slide.
Yeah.
Agreed. And also it's good to know that there was the follow-up 6 months down the road. That was going to be my question, is this the results right at 8 weeks, or do you carry on?
Yeah, it'd be good to do like a call out saying like about the sustained improvement. I think that's important.
Yeah.
Okay.
Sakina, what was the size of the study again? Was this the 22?
Yeah, 22.
Yeah, I think it's good. I just think at some point you got to get to a higher number
Mhm.
because it's a really good graph. And I actually like 32, but I'd have to go into it in detail to see. It's just that the sample size group of 32 is, or 22 is not very large, right? So that's the, you're onboarding a bunch of people right now. So it'll be really interesting if you could track, that same
Mhm.
information in those graphs as you onboard your people. And you said you had 100, right? So
We are on track to get 100 by end of the year.
Yeah.
We are at 50 right now.
yeah, and it's October, so by the time you get VC funding, it won't be till next year anyway. So I would really try and get those for that 100 people.
Okay. Yeah, the part of the plan is to so the North Pine has a research component where we are going to do the same. Like we are going to ask some of the patients if they'd be willing to participate in the study and track them as well. And even for the Syrian one, like we're going to be tracking the results. Like I think over time, like we'll build the sample size to be a larger one.
Yeah.
Absolutely. Yeah.
I was also wondering if it would be helpful to have statements from the practitioners who look at these people, just to say, indicating that your product is better than what they've been using, or, something like that.
Yeah, I like that.
Great feedback.
Also, it would be interesting to see how this product compares with the other types of PTSD treatment. So there were 2 other types of PTSD treatment that you introduced at the beginning of the pitch. Whether this is lower cost or more effective, or just some comparatives against other options.
I think that was in
We
there.
had it.
Yeah, the
Yeah.
CBD slide.
It wasn't there, but obviously it got lost.
Yeah.
Okay, great feedback. Thank you all very much. We only have 1 more minute, but I've been taking notes and we've got the recording, and we'll make sure Sakina gets that within the next 24 hours. Same with you, Karina. Thank you both. You did a fabulous job. Maureen, Linda, Marisa, Mary, Michelle, thank you all for being here. It really adds so much value to the program for you participating, and you contributed so much. So thank you all, and have a wonderful afternoon. I'll close for our next session.
Thanks for organizing. Great job, everyone.
Thank you.
Bye.